My name is Tim Ria with Digital Health Live here at the Digital Summer Summit in San Francisco. We have Peter Levin, who's the CEO of Amida Technology Solutions.
Amida Technology, yeah.
So we're getting here at like 3 o'clock, and I saw you up on stage with Bettina and Humetrics, and the topic was Killer Partnership number 3, Humetrics and the VA.
Right. So we spoke for a while around the partnership, of course, between VA and Humetrics, but really we spent a few minutes talking about what's going on right now at the VA. The VA has been in the news a lot recently because of access to care issues and the scheduling crisis that happened. And we talked about how the Blue Button program that Humetrics was just an essential private sector partnership in developing, how that helped us reach veterans at that time in a new and novel way, and how today it might actually be part of the solution going forward.
So tell everybody a little bit about your background and work with the VA, and then what is Blue Button, so they have some context.
Yeah, so there were 2 of us from the VA on the panel. One of us is still there. It's Dr. David Douglas, who's the Chief Medical Information Officer in the Portland VA, and David and I and several others work closely together. When I was there, I was the Chief Technology Officer at VA during the inception of the Blue Button program, and how we effectively created an open data platform, not open in the sense that we were insecure or not private. It was for the patient, and it was a very, very high barrier in order to make that channel of health information secure, private, I like to say hygienic. But it was really part of the Obama administration initiative to create these data platforms that enabled companies like Humetrics, that enable today companies like mine, Amida Technology, to build innovative solutions that help patients get better care. What's
Wrong right now? Why do we have such a panel on this topic?
Well, I think it's not a technology problem. I can tell you what it isn't. You might know that many physicians, many clinical care providers today still don't actually believe that it's a good idea to give patients their information. They might ask too many questions, they might misunderstand it, they might lose it. And we talked today at the panel, people said, well, how did you know when you were going to win? And I told the short story about how Secretary Shinseki at that time was staring down some ferocious opposition, both inside the VA and outside the VA, from people who thought it was just a bad idea to give patients their information. And so he said, listen, there's something I'm not following. So these are people who've carried loaded weapons to defend our liberties. Sadly, a few of them have had to use those weapons, and many people have died carrying those weapons, defending our country. And we trust them to do that. That's a very, very dangerous thing. That's truly a life-threatening thing. So now they come home and they have some kind of service-connected disability, or they have a certain entitlement to care because of their distinguished service. And you're telling me, if I'm following you right, you're telling me that we don't trust them to have their personal health information. And there's this pregnant pause in the room, and he sits there very sort of quietly, not taking his eyes off of his interviewer. And the guy says, yeah, you're right, that doesn't make sense, does it? And in that moment, we knew. In that moment, we knew that we were going to be able to put this program into production and today give people the complete, entire medical record that they have access to right now. Yeah.
So how does that change things?
It changes everything, right? So in the United States today, we have, the estimates vary. The lowest estimate is 100,000 people. The highest estimate is 400,000 people who die every year from avoidable medical errors. Now let me tell you what the low-end estimate feels like. That is more people than breast cancer, gunshot wounds, and automobile accidents combined. Now imagine the political latency, the political valency of an issue with that kind of broad societal impact. We are making, in my personal view, bad decisions about access to weapons. We're still losing far too many people on the roads, even with the extraordinary advances in transportation safety. We're making amazing advances in clinical science and in fundamental research, and we're taking important steps, life-saving steps in breast cancer, but we still haven't solved the problem. Now these are topics that every American knows, and I would say every citizen of the world understands in some way, and yet we are still losing more people than all of those in an avoidable way, where health information and access to personal health information, liquidity, interoperability, the security of that health information can literally save lives.
thought some legislation was supposed to take place in October this year, or what's going on with this rolling out for the rest of the population?
Yeah, so that's frankly it's a complicated policy question that I think you're referring to the meaningful use 2 standards. Yeah, I don't know that has been decided, but somewhere between institutional reluctance and people are kvetching about how hard it is and they don't want to, and there are some technology impediments for some of the hospitals that had somewhat underinvested in their technology infrastructure and their IT infrastructure. I'm frankly personally very sympathetic to that. But the fact of the matter is we're going to do it. We're going to create a health IT infrastructure in the United States that's life-saving, that's cost-saving, and that's health-improving.
So what's your company, and how do you play a role in the space now?
Oh, thank you for asking. So Amida Technology Solutions is an open source software company. We've created infrastructure components that enable the broad and fast adoption of health information components generally, and Blue Button components specifically. Our flagship product, we just announced it last week, is a so-called, thank you very much, is a so-called data reconciliation engine, which absorbs Blue Button records, PDF files, HL7 records, all different kinds of standards, codes, and formats, puts them into a consolidated data model, and then allows the patients in a semi-automated way to say, okay, well, wait a second, no, I don't take that medicine, or I used to have that allergy and it's better now, or I didn't have that surgery, but I did have this surgery, and you get to actually have the patient control the longitudinal record, again, in a very safe, secure, and private way.
So you just launched. Congratulations. That's awesome.
Thank you very much. Yeah.
So what's next for you, and how do people connect?
Oh, well, I am at Levin, Plevin, at Twitter. And Amida is amida-tech.com, and we welcome all input.
All right, Peter, thanks so much, and a great panel. Appreciate you taking the time to be down here.
My pleasure. Thanks for the opportunity.